Thank you so much. As I've been introduced, my name is Kalungwana, and I am the Mental Health and Psychosocial Support Technical Advisor on the USAID Checkup Tour activity. And I am going to speak about an implementation that helps us to understand some of the social determinants and correlations between HIV and mental health amongst adolescent girls and young women. So I think the conversation around mental health, HIV, and adolescence has been clearly established in this conference and really around the world. We've seen a lot of studies that have been carried out that have shown that mental health and HIV have had a clear correlation, and some of the things that impact that are things like poor access to sexual and reproductive health services, experiencing adverse childhood events, increased use of substance use and alcohol, all of this which are intertwined and will increase mental health problems among AGYW. However, we still see such a dearth of literature that interlinks the relationship between HIV and mental health, particularly among AGYW in sub-Saharan Africa. So in our intervention, Checkup 2 is just an abbreviation that stands for Controlling HIV Epidemic Amongst Key and Underserved Populations. And under the Checkup 2 activity, we provide comprehensive services aimed at HIV prevention, and we integrated mental health as part of the prevention strategy. So under the USA Checkup 2 activity, we reach our AGYW through the DREAMS program, and like I mentioned, we have incorporated mental health as a program and a service delivery package among AGYW in Zambia. So as part of this, we were able to enroll AGYW, we were able to enroll up to 14,000 AGYW using an HIV risk assessment tool. And in this tool, we were able to assess 7,365 adolescent girls and young women for common mental health disorders. PHQ-9 we used to assess for depression, and we used G87 to assess for anxiety, and we used the CAGE-8 to assess for substance abuse. We then used some descriptive statistics to determine the relationship between HIV and mental health. So we did this analysis by age band. So if you look at the purple, this represents our age bands 10 to 14. And we can see that in this age band, we had emotional and physical abuse as a determinant for those who were more willing to access mental health problems, mental health services. Orphanhood also was a determinant for the 10 to 14 age band. When you look at the 15 to 19 age band, we saw that irregular condom use, alcohol use was also a high determinant in there. And when we look at the 20 to 24 age band, we look at irregular condom use, having multiple sexual partners, and engaging in transactional sex. So when we look at this, we see that most of the information that's there looks at how some of the things that will put you at risk of getting HIV will also give you more mental health problems. And this is something that has been highlighted in a few studies, but I think that we need to be a bit more cautious and understanding how we can use these factors to prevent those who are uninfected from getting HIV. So in conclusion, I would say that understanding of sexual determinants and correlates of HIV and mental health adds to improved service delivery that is targeted at adolescent girls and young women. And our intervention shows that it is important to provide bi-directional interventions, so we just don't use mental health on its own, but if we integrate sexual reproductive health services as well, then we're impacting the service clearly. And also, I think that there's a lot of talk that has focused on HIV and mental health in treatment, but we see very little information about HIV and mental health in HIV prevention. So I think this intervention shows us that if we can tackle mental health issues to uninfected adolescent girls and young women, we are able to prevent them from getting HIV at an early stage. Lastly, if we're able to integrate mental health HIV programming that is age-specific and context-specific, then we're able to address the specific social determinants that will be experienced by adolescent girls and young women. And these are some of my references, and I'd like to thank all the adolescent girls and young women and the DREAMS team for all the work that they have done for us. Thank you.